Small molecules called peptides are quickly becoming one of the most talked about tools in modern health optimization. But what exactly are peptides, and why are doctors and researchers so interested in them? Let's take a clear, balanced look at the science behind these tiny messengers. Have you ever wondered how your body knows exactly what to do? How a cut on your finger starts to heal almost immediately? Or how your muscles know to rebuild stronger after a tough workout? The answers lie in a complex world of biological communication. Our bodies are constantly sending and receiving messages. These messages are carried by tiny but powerful molecules. They are the secret couriers working tirelessly behind the scenes. These remarkable molecules are called peptides, and they are unlocking a new frontier in health and medicine. Imagine your body as a vast and bustling city. Every cell is a building with a specific job. To keep the city running smoothly, messages must be sent quickly and accurately. Peptides are like specialized text messages or priority emails within the city. They carry precise instructions from one group of cells to another. A peptide can signal a command like start healing, reduce inflammation, boost metabolism, or release this hormone. They are the fundamental language of cellular function. As we delve deeper, we will explore what peptides are in simple terms. We will look at why they are gaining attention from clinicians and patients alike. We will discuss specific peptides, safety, regulation, and responsible use. In the simplest terms, peptides are small proteins. To understand this, we need to talk about amino acids. Amino acids are often called the building blocks of life. When you eat protein-rich foods like meat, fish, or beans, your body breaks them down into amino acids. When these amino acids link together in a short chain, typically under 50, it is called a peptide. Longer, more complex chains are proteins. Think, one brick, a small structure, and a castle. Because peptides are small, they can be absorbed and utilized relatively easily. Their size allows highly specific signaling. They fit receptors like a key in a lock to deliver precise messages. This specificity makes them especially interesting in medicine. The body naturally produces thousands of peptides. They regulate digestion, immune response, hormone signaling, brain function, sleep cycles, and tissue repair, keeping you in balance, or homeostasis. If peptides are a natural part of our biology, why are we hearing so much about them now? Advances in biotechnology made it possible to produce specific peptides with high purity at lower cost, unlocking more research and clinical use. Scientists can isolate or synthesize peptides that target very specific pathways. Applications span athletic recovery, metabolic health, and cognitive function, moving from theory to practice. Healthcare is shifting toward personalized and preventative care that addresses root causes, not just symptoms. Because peptides act as signals, they can help restore normal function at the cellular level. Information spread via podcasts, forums, and forward-thinking clinics fuels curiosity and demand. Anecdotes meet emerging science. Many now seek knowledgeable providers to explore whether peptides fit their goals. A key draw is specificity. A peptide designed for a receptor may act locally with fewer off-target effects. That precision appeals to clinicians aiming for effective options with favorable safety profiles for the right patients. To make this concrete, let's look at 5 examples frequently discussed in clinics and research. Important reminder, research is ongoing. This is educational, not a recommendation. BPC 157 stands for Body Protection Compound. It is a synthetic version of a protective protein found in the stomach. It is being studied for supporting tissue healing in muscle, tendons, ligaments, and the gut lining. It often draws interest from sports medicine and gastroenterology. TB500 is a synthetic fragment of thymosin beta-4, a peptide found in nearly all human and animal cells. It is linked to tissue repair, promoting cell migration and blood vessel formation while reducing inflammation. It has attracted attention in recovery from acute injuries and in support of chronic wound healing. Athletes and post-surgical patients often ask about it. MoTSC is a mitochondrial-derived peptide. Mitochondria are the cell's energy powerhouses. MOTC helps regulate metabolic function, how the body uses sugar and fatty acids. It is being studied for insulin sensitivity, physical performance, and endurance. Interest spans metabolic health, healthy aging, and optimizing cellular energy for sport. Quick overview. These 5 appear often in discussions, each with different potential roles. CMAX, developed in Russia, is studied for neuroprotective effects and as a nootropic. Research explores roles in stroke recovery, attention, memory formation, and possibly increasing BDNF, which supports neuron survival and growth. Selenk, also from Russian research and related to a natural peptide, is studied for anxiolytic and immunomodulatory effects, calming without sedation and balancing immune responses. Who might benefit from learning about them? Individuals interested in cognitive support, stress regulation, or where stress and immune dysregulation overlap. Summary: what they are studied for, and who might be curious. The tone here is educational and balanced. Further clinical evidence is needed, and guidance is essential. Interest spans athletes, wellness seekers, older adults, and patients with specific goals. Athletes, pro and amateur, look to accelerate recovery, reduce inflammation, and heal from injuries. They often ask about BPC 157 and TB 500 for potential muscle, tendon, and ligament support. Healthy aging and longevity groups seek support for energy, muscle maintenance, metabolic changes, and cognitive function. Post-op patients and injury recovery cases explore peptides to potentially support regeneration, decrease swelling, and promote new blood vessel growth. Some with complex chronic issues include peptides within comprehensive plans, alongside diet, lifestyle, and targeted supplementation. Peptides are one tool, not a magic bullet. Use should involve medical guidance and individualized evaluation to fit the right pathway at the right time. While potential benefits are exciting, safety is paramount. These are powerful biological molecules and not suitable for everyone. Clear contraindications include pregnancy and breastfeeding. Pregnant, planning to become pregnant, or nursing, avoid. Personal or strong family history of certain cancers warrants extreme caution or avoidance. Because some peptides influence growth factors, there is a theoretical risk of stimulating pre-existing cancer cells. Use caution with complex uncontrolled conditions or multiple medications. Interactions are not always well documented. For instance, a metabolism-acting peptide could unpredictably affect a patient on insulin or glucose-lowering meds. Autoimmune disease requires careful evaluation. Immune-modulating peptides can help or harm if misapplied. Work with a qualified clinician, source from reputable compounding pharmacies, and follow a plan with clear goals, duration, and monitoring for benefits and side effects. In the United States, peptide regulation is complex and evolving. It affects access, quality, and safety. Some peptides, like insulin, are FDA-approved drugs, but many used in integrative care are not. These often fall under compounding rules, distinct from mass manufacturing. FDA guidance determines what can and cannot be compounded. Recent scrutiny moved certain peptides onto restricted lists, creating uncertainty and limited availability. Drivers include insufficient safety or efficacy data, duplication of approved drugs, and challenges ensuring bulk ingredient quality. Clinics should be transparent, source from compliant facilities, and stay current with FDA guidance. Above all, prioritize safety, quality, and adherence to the law. At Daisy Family Healthcare, peptides are part of a broader integrative and preventative approach. The team emphasizes personalized care, functional and preventative medicine, and patient education. Peptides are one tool, introduced only after foundations like nutrition, sleep, stress management, and activity are in place. They use in-depth history and advanced testing like GI map and organic acids to inform decisions. If a peptide fits a pathway and goal, they discuss science, benefits, risks, and regulatory context, sourcing from reputable pharmacies. Examples include pairing peptides with physical therapy for recovery, or short-term signaling support alongside nutrition for metabolic concerns. Balanced, cautious, and patient-centered, that is responsible peptide use in primary care and functional medicine. If you're curious about peptides or interested in learning more about personalized approaches to health, Daisy Family Healthcare offers consultations to help patients explore their options safely and responsibly. Daisy Family Healthcare, Avondale, Arizona. Phone, 602-3444-9737. Website, daisyfamilyhealth.com. This video is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with a qualified healthcare professional before starting any medical therapy.